Now let's queer up health. Twice a year, Lenacapavir is an effective new HIV prevention solution for women. A groundbreaking study published in the New England Journal of Medicine reveals that Lenacapavir, administered twice a year, offers 100% protection against HIV infections in women and girls. The phase 3 trial conducted in Africa involved over 5,000 HIV-negative women and girls, all of whom remain free from the virus. This study presents a significant advancement over daily pre-exposure prophylaxis, or PrEP, like Truvada. The Purpose 1 trial, a double-blind study, compared Lenacapavir injections every 26 weeks with daily HIV medications. No infections occurred in the Lenacapavir group, while 55 total infections were recorded in the other groups. In a new release, drugmaker Gilead announced that it anticipates results from the Purpose 2 trial later this year and in early 2025. This trial is pivotal in evaluating the efficacy of twice-yearly Lenacapavir for preventing HIV infections among men, transgender women, and gender nonbinary people who have sex with partners assigned male at birth. The study is being conducted in Argentina, Brazil, Mexico, Peru, South Africa, Thailand, and the United States. For women, lesbians, and queer women, these findings are transformative. Consistent and long-term protection against HIV means reduced anxiety over daily medication adherence and an increase in control over their sexual health. This is particularly vital for communities where healthcare access and consistent medication use can be problematic. I mean, this really is a game changer for women because not having to be at the, I mean, most of the women contracting HIV are Black women.
Yeah.
And
number one
they,
number one in the country in Miami.
Yeah, and they are generally at the mercy of their partner.
Yeah.
And this breakthrough really does give these women independence.
Yeah.
That they can make sure that they can take care of their own health by taking this twice annual medication and not have to worry if their partner's going out and messing around and bringing something back to them.
Yeah.
I think it is amazing. And I hope that, you know, it proves to work with men as well, because it's totally a game changer.
Twice a year, Lenacapavir. Sounds like a good ad campaign, doesn't it? Rhymes and everything.
Right? But, you know, I mean, I'm sorry, did you have more to say?
No, I'm available if they want to hire me.
Listen, this is great news, okay? It shows us that there might be hope for eradicating HIV/AIDS in our lifetime, right? Wouldn't that be incredible? You know? My wife is a nurse practitioner at Pride Lines, and you know, she finds it difficult. She says that it's difficult to get our community to come and get, you know, to come a couple times a week or a couple times a month, right? It's just very hard. We have busy schedules. Things happen, blah, blah, blah. You know, it's not always the easiest access to get also healthcare when it comes to LGBTQ+, right? The center that offers the services to you might be far away, whatever it is. So this is a total game changer. I mean, 2 times a year is completely incredible. Incredible. And it's just also more hope, right? People are still working towards this you know, this to be eradicated, you know, and I really hope it does.
You know, I hope so too, because this really, Queer News Tonight, we've covered this more than once because it is an important drug, especially the fact that it will be helping women. But I'll always mention the issue of like, well, you know, one of the other things with PrEP and Gilead products is they do price them very high. And, you know, what are they going to charge for twice a year? Are they going to, that doesn't sound that expensive. Are they going to price it moderately? How, that's, you know, like.
I had twice a year infusions and they are not cheap.
Exactly. And like we as a community really need to like push Gilead and our government who does help fund, like the NIH did help give grants to some of the research on this drug. And like, are we, the taxpayer, going to make sure that we and the world benefits from this, or does Gilead's shareholders be the only ones that gain?
Yeah, I agree. I mean, right now, there's so many free PrEP programs out there. I mean, Part of it is Gilead, part of it is government-driven, part of it I know that like private charities have been doing this, but we cannot just rely on charity. The drug company has to take proactive action to make sure that these life-saving drugs can be delivered at a reasonable cost, hopefully insurance covered to
That's the key.
the public.